Welcome to UMCC, Medical Consultant Connectors, where your health matters to us. Have you ever heard about acute nephrotic syndrome? If not, allow me to introduce you. Acute nephrotic syndrome is a serious kidney disorder that can have significant effects on the body. It's not as well known as other kidney conditions, but it's just as important to understand. In a healthy body, our kidneys work as diligent filters, removing waste while keeping essential proteins in our blood. However, when acute nephrotic syndrome strikes, it's as if these filters develop holes. This leads to an excess of protein slipping through and ending up in our urine. This protein loss can have a wide range of effects on the body, from swelling and fatigue to increased susceptibility to infections. The good news is, the more we know about acute nephrotic syndrome, the better we can handle it. By being aware of its causes, symptoms and treatments, we can work towards effective prevention and management. Understanding acute nephrotic syndrome can help us prevent and manage this condition effectively. What causes acute nephrotic syndrome, you may ask? The principal culprits are diseases that inflict damage on the kidneys. Let's start with diabetes. This chronic condition can lead to kidney damage over time, causing acute nephrotic syndrome. Lupus, an autoimmune disease, is another key player. It can trigger an aggressive attack on the kidneys, resulting in this syndrome. Infections are also a significant cause. HIV, an infection that targets the immune system, can lead to kidney damage and subsequently acute nephrotic syndrome. Hepatitis B, a viral infection that attacks the liver, can indirectly harm the kidneys, causing our syndrome in question. Malaria, a severe, sometimes fatal disease spread by mosquitoes, can also damage the kidneys and lead to acute nephrotic syndrome. It's important to note that these are just some of the causes. Other factors can contribute to the development of this syndrome, but knowing the causes can help us steer clear of this syndrome. How can you tell if you have acute nephrotic syndrome? If your body is battling acute nephrotic syndrome, it might send you several signals. One of the most common symptoms is severe swelling, particularly noticeable around your eyes and in your ankles and feet. This is caused by an excess of proteins in your urine, a condition known as proteinuria, which leads to low protein levels in your blood and results in fluid accumulation in your tissues. Another telltale sign could be the appearance of your urine. It might become frothy or foamy, almost like a beaten egg white. This too is a result of high protein levels in your urine. You might also experience sudden and unexplained weight gain. This isn't because you're suddenly packing on pounds, but because your body is retaining more fluid than it should. Remember, these symptoms can easily be mistaken for other conditions, but if they persist, seek medical advice. Recognizing these symptoms early could be a lifesaver. How is acute nephrotic syndrome diagnosed and treated? This is a question that requires a thorough understanding of the medical procedures involved. To diagnose acute nephrotic syndrome, doctors often rely on a series of tests. A urine test, for instance, can reveal high levels of protein, a telltale sign of the condition. Blood tests, on the other hand, can show low levels of protein and high cholesterol, also indicative of the syndrome. In some cases, a kidney biopsy might be necessary to confirm the diagnosis. Once the diagnosis is in place, the treatment involves managing the symptoms and addressing the underlying causes. This usually involves medications, including blood pressure drugs, cholesterol-lowering drugs, diuretics, and sometimes immunosuppressants. Each case is unique, and the treatment is tailored to the individual's needs and overall health condition. Early diagnosis and appropriate treatment can significantly improve the prognosis. So if you notice any symptoms, don't delay in seeking medical help. Can we prevent acute nephrotic syndrome? Well, there's no foolproof way to completely stave off the condition, but we can certainly take steps to minimize the risk, and it all starts with managing underlying conditions like diabetes. If you're living with diabetes, ensuring that your blood sugar levels are well controlled is paramount. Moving on, maintaining a healthy lifestyle can't be stressed enough. This includes a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Regular physical activity, whether it's a brisk walk in the park or a sweaty gym session, will also help keep your kidneys in good shape. But prevention isn't just about what you do at home. Regular checkups are crucial for early detection and intervention. This means getting routine blood and urine tests to monitor kidney function, especially if you have risk factors for kidney disease. So remember to take care of your health inside and out. Prevention is always better than cure, and it's no different with acute nephrotic syndrome. Let's recap what we learned about acute nephrotic syndrome. It's a kidney disorder resulting from causes like diabetes, lupus, or certain infections. Symptoms can range from swelling in the legs to fatigue. A urinalysis is often key to diagnosing it, and treatment can involve medications and lifestyle changes. Prevention is not always possible, but managing underlying conditions and leading a healthy lifestyle can reduce risks. Stay informed, stay healthy, and remember your health is in your hands. UMCC, your ultimate medical consultant connector.